I want to talk to you today about something you do every single night without a second thought that turns out to have a genuine, if modest, and often overstated relationship to your heart, the position you sleep in, and particularly which side you lie on, and what's true and what's exaggerated about sleep position and the heart. Because you'll have seen the dramatic claims that sleeping on one side is dangerous for your heart or that a particular position protects it, and these spread widely, yet the real picture is more measured and more useful than the headlines. So, understanding what sleep position genuinely does and doesn't do for your heart, accurately and without the fear mongering, is genuinely worthwhile. So, today I want to explain what's true about sleeping on your left or right side, why people with heart conditions sometimes prefer one side, the genuine issue of sleeping flat versus propped up, the real sleep matter that affects the heart far more than position, and what to do in partnership with your doctor. And I'll keep this calm, accurate, and balanced because while there are grains of truth here, most healthy people needn't worry about which side they sleep on. And the truly important sleep and heart messages lie elsewhere in partnership with your doctor. This is about separating a genuine but modest effect from the exaggeration around it. Let me start with what's actually true about which side you sleep on, because it dissolves most of the fear. Let me address the popular claim head on. Does the side you sleep on harm or help your heart? For the vast majority of people with healthy hearts, the honest answer is that it doesn't meaningfully matter, and you should sleep in whatever position is comfortable and lets you rest well. There's a grain of truth behind the claims. Because of where your heart sits and how it's connected to the large blood vessels, lying on the left side can slightly shift the heart's position and can, in some people, make them more aware of their heartbeat. And some studies of the heart's electrical tracing show minor changes with left side lying, but these are generally minor and not harmful in a healthy person. So, the dramatic claim that sleeping on your left side damages your heart is not supported for healthy people. At most, some people simply find they're more aware of their heartbeat on that side. So, for healthy hearts, the side you sleep on doesn't meaningfully harm or help the heart despite minor positional effects, so comfort and good rest should guide you. So, understanding that sleep side doesn't meaningfully matter for a healthy heart is the reassuring foundation. So, sleep side barely matters for a healthy heart. So, sleep where you're comfortable. Let me explain why some people with heart conditions prefer one side, because there's genuine truth there. Now, there is a genuine phenomenon worth understanding for people who already have significant heart conditions, particularly heart failure. Some people with heart failure find they're uncomfortable, or more aware of their heart, or more breathless, lying on their left side, and naturally prefer their right side, or prefer to be propped up. This is a recognized preference, thought to relate to how position affects the heart and the sensations from it in a struggling heart. But notice what this means. It's a matter of comfort and is something the person notices and adjusts to naturally, not a hidden danger you need to police, and it applies to people with established heart conditions, not to healthy people. So if you have heart failure and find one side more comfortable, sleep that way. But this is about comfort, not about a sleeping position causing or preventing heart damage. So some people with heart failure naturally prefer their right side or being propped up for comfort, a recognized preference to follow. But this is about comfort in an existing condition, not a position causing or preventing heart damage. So position preference in heart failure is about comfort. So follow your comfort if you have a heart condition. Let me get to the genuinely important position issue, flat versus propped up, because this one truly matters. Here's the sleep position issue that genuinely matters for the heart, and it's not left versus right, it's flat versus propped up. As I've discussed at length in heart failure, lying flat can cause breathlessness called orthopnea because lying down returns and redistributes fluid toward the chest and lungs, overwhelming a struggling heart, while propping up relieves it. So if you find you can't lie flat without becoming breathless and need to prop up on pillows or sleep in a chair to breathe, that is genuinely significant, but not because flat sleeping is inherently bad, rather because needing to avoid it is a telling sign of heart failure that warrants medical assessment. So the position issue that truly matters isn't which side, but whether you can lie flat at all, since needing to sleep propped up to breathe is a meaningful heart sign, which I've discussed. So the genuinely important position issue is flat versus propped up. Needing to prop up to breathe is a telling sign of heart failure warranting assessment, unlike the trivial question of which side. So flat versus propped up is the position issue that matters. So needing to sleep propped up to breathe is the real signal. Let me point you to the sleep matter that affects the heart far more than position, because this is the useful redirection. Here's what I most want you to take away. The aspect of sleep that genuinely affects your heart isn't your position at all. It's the quality and character of your sleep, and one condition in particular. Sleep apnea, where your breathing repeatedly pauses during sleep, often signposted by loud snoring, gasping, or choking in sleep, and daytime sleepiness, is genuinely important for the heart because, as I've discussed, it's associated with high blood pressure, heart rhythm problems like atrial fibrillation, heart failure, and increased cardiovascular risk, and it's common and very treatable. So if you snore heavily, gasp in your sleep, or are sleepy by day, that matters far more for your heart than which side you lie on, and is worth mentioning to your doctor. More broadly, getting enough good quality sleep supports heart health, while chronic poor sleep is associated with higher cardiovascular risk. So redirect your attention from sleep position to sleep quality and sleep apnea, which genuinely affect the heart. So the sleep matter that affects the heart far more than position is sleep quality, and especially sleep apnea, which is common, cardiovascular relevant, and treatable. So heavy snoring, gasping, or daytime sleepiness warrant mentioning. So sleep quality and apnea matter far more than position. So attend to how you sleep, not which side. Let me note the other genuine sleep and heart connections because they round out the picture. Let me note a few other genuine connections kept in proportion. Heart events have some tendency to cluster in the early morning hours related to natural rhythms in blood pressure and the body's chemistry, which is a real pattern but not something sleeping position changes or that should cause worry. Waking in the night with symptoms matters. Waking suddenly breathless, as I've discussed, or with chest discomfort is worth heeding. And as I've discussed, some people become more aware of their heartbeat or pulse at night simply because it's quiet, which is usually benign. So beyond position, the genuine night and heart connections are the morning clustering of events, the significance of waking with symptoms, and benign nighttime awareness of the heartbeat. So, other genuine connections include the early morning clustering of heart events, the importance of heeding waking with breathlessness or chest discomfort, and usually benign nighttime heartbeat awareness. So, there are real night and heart links beyond position. So, heed waking with symptoms and don't fear the rest. Let me be clear about what genuinely protects your heart because that's the real message. Let me redirect firmly to what genuinely protects your heart since it's far more important than sleep position. Your heart is protected by managing your actual risk factors with your doctor. Your blood pressure, cholesterol, blood sugar, not smoking, staying active, eating well, and maintaining a healthy weight as I've discussed. Good sleep supports this, and treating sleep apnea if you have it genuinely helps, but no sleeping position substitutes for any of it. So rather than worrying about which side to sleep on, put your energy into these established measures and into getting good quality sleep and any sleep apnea treated. So, what genuinely protects your heart is managing your established risk factors and getting good quality sleep, including treating sleep apnea, far more than any sleeping position. So, focus on real risk factors and sleep quality, not position. So, the real protection is risk factor management and good sleep. Let me be clear about what to do because the response is refreshingly simple. So here's what to do. If you have a healthy heart, sleep in whatever position is comfortable and lets you rest well without worrying about which side. If you have heart failure and find one side or being propped up more comfortable, sleep that way for comfort. Crucially, if you can't lie flat without becoming breathless and need to prop up or sleep in a chair to breathe, see your doctor since this is a meaningful sign of heart failure. If you snore heavily, gasp, or choke in your sleep, or are sleepy by day, mention it to your doctor since sleep apnea genuinely matters for the heart and is treatable. Seek urgent care, as always, for waking with severe breathlessness, chest pain, or the emergency features I've discussed, and put your real effort into managing your cardiovascular risk factors and getting good sleep. So sleep comfortably if healthy, follow comfort if you have a heart condition, see your doctor if you can't lie flat or if you have sleep apnea signs, and focus on your risk factors. So the response is to relax about position and attend to what matters. So sleep comfortably and attend to the real signals. Let me paint you a quick picture of how this helps. Picture a woman in her 70s who reads a frightening article claiming that sleeping on her left side is damaging her heart and becomes anxious every night, sleeping poorly as she tries to force herself onto her right side and lies awake worrying. Understanding the accurate picture that for a healthy heart, the side she sleeps on doesn't meaningfully matter, and that the anxiety and poor sleep are doing her more harm than the position ever could, she relaxes and sleeps comfortably again. But she also takes the genuinely useful lessons. She realizes she snores heavily and is sleepy by day, mentions it to her doctor, and is found to have treatable sleep apnea, which genuinely matters for her heart, and she has her blood pressure and cholesterol checked and managed. The same woman, but with the fear-mongering replaced by accurate understanding, sleeps better, gets a real heart-relevant condition treated, and manages her actual risk. That contrast is exactly why separating the truth from the exaggeration matters. Let me speak briefly to those of you caring for an older parent or partner. Understand that for a healthy heart, the side someone sleeps on doesn't meaningfully matter, so dramatic claims about left side sleeping damaging the heart needn't cause worry, and comfort and good rest should guide position. But some genuine points matter. Someone with heart failure may prefer one side, or being propped up for comfort, which is fine to follow. Needing to sleep propped up or in a chair to breathe is a meaningful sign of heart failure warranting assessment, and heavy snoring, gasping in sleep, or daytime sleepiness can signal sleep apnea, which genuinely matters for the heart and is treatable. You can help by reassuring a loved one about position, while encouraging them to mention an inability to lie flat or sleep apnea signs to their doctor, and supporting good sleep and management of their actual cardiovascular risk factors. Crucially, seek urgent care for waking with severe breathlessness or chest pain. Helping a loved one separate the truth from the fear-mongering can improve their sleep and catch what genuinely matters. So let me draw this all together. The position you sleep in, and particularly which side, has a genuine but modest and often overstated relationship to your heart. For the vast majority of people with healthy hearts, the side you sleep on doesn't meaningfully harm or help the heart, despite minor positional effects, so comfort and good rest should guide you, and the dramatic claims are largely fear-mongering. Some people with heart failure naturally prefer one side or being propped up for comfort, which is fine to follow. The position issue that genuinely matters isn't left versus right, but flat versus propped up. Needing to prop up to breathe is a telling sign of heart failure warranting assessment. And, most usefully, the aspect of sleep that truly affects the heart is its quality, especially sleep apnea, which is common, cardiovascular relevant, and treatable, so heavy snoring, gasping, or daytime sleepiness matter far more than position. So sleep comfortably, see your doctor if you can't lie flat or have sleep apnea signs, and put your real energy into your risk factors and good sleep. So here's what I'll leave you with, straight and clear. First, understand that for the vast majority of people with healthy hearts, the side you sleep on doesn't meaningfully harm or help your heart, despite minor positional effects like being slightly more aware of your heartbeat on the left. So the dramatic claims are largely fear-mongering, and you should sleep in whatever position is comfortable and lets you rest well. Second, know the genuine exception for comfort. Some people with heart failure naturally prefer their right side or being propped up, a recognized comfort preference to follow, though this is about comfort in an existing condition, not a position causing or preventing heart damage. Third, know the position issue that genuinely matters, which is flat versus propped up. Needing to prop up on pillows or sleep in a chair to breathe, because lying flat makes you breathless, is a telling sign of heart failure that warrants medical assessment, quite unlike the trivial question of which side. Fourth, redirect to the sleep matter that affects the heart far more than position, sleep quality, and especially sleep apnea, where breathing repeatedly pauses in sleep, signposted by heavy snoring, gasping, or choking in sleep, and daytime sleepiness, which is genuinely associated with high blood pressure, rhythm problems, heart failure, and cardiovascular risk, and is common and treatable, so it's well worth mentioning to your doctor. And fifth, put your real energy into what genuinely protects your heart, managing your established risk factors with your doctor, blood pressure, cholesterol, blood sugar, not smoking, staying active, eating well, and a healthy weight, alongside getting good quality sleep and treating any sleep apnea while sleeping comfortably in whatever position suits you, seeing your doctor if you can't lie flat without breathlessness or if you have sleep apnea signs, and seeking urgent care for waking with severe breathlessness. chest pain, or other emergency features. The side you sleep on barely matters for a healthy heart, so you can let that worry go, while the things that genuinely matter, being able to lie flat, treating sleep apnea, and managing your risk factors, are where to put your attention, which is well worth doing. So take care of yourself, sleep comfortably without fearing your position, heed being unable to lie flat, get sleep apnea signs checked, and manage your real heart risk. And because sleep position barely matters for a healthy heart while sleep apnea and being unable to lie flat genuinely do, please treat needing to prop up to breathe or heavy snoring, gasping in sleep, and daytime sleepiness as your reason to see your own physician. Put your energy into managing your actual cardiovascular risk factors and good sleep rather than worrying about which side you lie on, and treat waking with severe breathlessness or chest pain as your reason to seek urgent care. This touches on sleep, which affects well-being. So if poor sleep or worry about your heart at night is troubling you, please know your doctor can help find the cause, including treatable conditions like sleep apnea, and improve both your sleep and your heart health.